Welcome back. Nurses are leaving the healthcare industry in record numbers. Hospitals are now short-staffed at a time when COVID patients are desperate for care.
Chris Conti shows us the ways that some colleges are trying to prevent nurse burnout before they even graduate.
Take off my cap.
It's intense. It's really intense.
At first glance, it all seems so real.
I'm gonna pour some saline.
You'd never know that this was not an actual emergency room.
Hold pressure.
But when you look a bit closer, it is apparent that these patients are not patients at all.
The rates of COVID have gone up.
That is Annie Nelson. She is a nursing student here at the University of Tennessee Knoxville's College of Nursing. Now in her senior year, this 22-year-old is getting ready to graduate, and she's already feeling the strain of being a nurse.
It was a lot.
When nearby UT Medical Center hit record low staffing levels a few months ago, students like Annie were suddenly called in to help. As part of a new pilot program between the university and the ER here, students are being tapped to help combat a severe nationwide shortage of nurses. The need is critical.
They ask me to come in all the time, and I feel bad saying no, but with school and stuff, it's how do I prioritize?
I think this pandemic has taught me a lot about myself and taught me a lot about the love I have for this field.
Working in a real hospital in the middle of a pandemic has taught these kids a lot.
It has taught me a lot about patience and how to really value what I do and value life in general.
The healthcare workforce continues to see doctors and nurses leaving the profession in droves. By 2030, Florida will be short more than 59,000 nurses. California short by 44,000 nurses. And Texas estimated to be short 15,000 nurses by the end of the decade. With burnout rates incredibly high among nurses right now, nursing schools across the country are trying to better prepare students for when they go out into the world.
People go into nursing because they care.
Victoria Niederhauser is the dean of the nursing college here. A few hundred kids graduate from the program each year, but many end up leaving healthcare after only a year or two.
We are really trying to educate the next generation of nurses in the best way we can of how do you take care of yourself.
These fingers here and then hold it with these fingers.
As a result, professors here have shifted their focus. Yes, aspiring nurses are still being taught how to start an IV, but they are also learning the importance of self-care.
It's very hard for them to think that they have to give to themselves. And so I think the message that we're trying to provide to our students is you have to take care of yourself. You won't stay in this profession long if you don't.
Putting myself first has been a real issue and a challenge during these times because I feel bad not taking care of these people, but I have to put myself first in order to help other people.
The hope is that when students like Annie Nelson get full-time jobs, they'll be better able to manage the pressures of being a nurse, especially right now during COVID.
Just remembering why I wanted to be a nurse in the first place.
Working this pandemic has not made me turn away from the healthcare field. It's actually driven me more towards it.
That kind of passion is what teachers here are trying to help these students hang on to, knowing full well the kinds of things they'll face in this pandemic. In Knoxville, Tennessee, I'm Chris Conti.